Good morning, everyone, and welcome to part one of WorkCover Queensland's Mental Injury webinar series. My name is Eve Faulkner. I am the Head of Communication here at WorkCover Queensland, and I will be your host for today. Before we begin, I would like to pay my respects and acknowledge the Yagara and the Turrbal people, who are the traditional owners of the land on which we're presenting to you from today. We'd like to thank them and their elders past and present for their ongoing commitment to land, water, culture and community. And I would like to also recognise the rich traditions of storytelling, knowledge sharing and connection that have supported the mental health and emotional wellbeing of Aboriginal and Torres Strait Islander people for generations. Given the topic of our webinar today, I would also like to acknowledge those with lived experience of mental ill health or distress and also their support networks. If you do find the content of today's presentation distressing or triggering, we very much support your decision to prioritise your wellbeing and self-care and to rejoin us when you feel able to do so. You'll see on the screen a flannel flower. The flannel flower is an Australian native flower and it symbolises resilience, gentle strength and hope, making it an apt representation for mental health. It's known for its ability to thrive in challenging conditions. It reflects the human capacity to endure and grow through adversity. And its soft petals embody compassion and the healing power of nature. We use the flannel flower here at WorkCover as a representation for the work we do around mental injuries and mental health. And I think it's a really beautiful symbol for what we're talking about today. So onto some quick housekeeping. We will record this session today and we will later send a link of the recording along with the slide pack as well as a survey to gather your feedback. The recorded session will also be uploaded to our social media networks and YouTube. Please feel free to submit your questions using the Q&A button in the toolbar and we'll get to as many as we can. We may not get to all of them and we're unable to answer any policy or claim specific questions. And if you have any of those, we encourage you to reach out to your relationship manager if you have one or your customer advisor handling your claim. If you have any technical issues, please refer to the help button under more, which you'll find in the toolbar at the top of your screen. Before I introduce our guest speaker, I would like to remind everyone that any information provided today, including in response to questions by us as WorkCover or by our wonderful guest speaker, is general in nature only and shouldn't be relied on as any legal or claim-specific advice. I would now like to introduce you to today's guest speaker. Dr Deborah Simmons is a senior consultant anaesthetist with the Australian and New Zealand College of Anaesthetists and a rural generalist with the Australian College of Rural and Remote Medicine. She works in a number of roles for Mackay Hospital and Health Service and privately in Rockhampton. Deborah has a passion for talking about her experience with post-traumatic stress disorder in the hope of passing on the message for early treatment and return to work. A very warm welcome, Dr. Deb. Before I hand over to Dr. Deb, I thought we'd touch quickly on some trends that we're seeing here at WorkCover around mental injuries. So quickly on some definitions, we'll talk about two types of mental injuries today. A primary mental injury is identified where that is the primary reason for an injury. So it could be things like post-traumatic stress disorder, but that's the primary mechanism, whereas a secondary mental injury are where we might see someone who's had a physical injury, for instance, who has been struggling to adjust to life with their physical injury, and we've seen that develop into also a mental injury. So that's some definitions. So in terms of scale, if we look in 2023-24, and these statistics all come from our annual report, which are available on our website, we accepted 74,127 claims, and of those 3,364 of them were for primary mental injury. So despite making up only about 4.5% of accepted claims, they accounted for 14% of our total statutory claim costs. You can see here, primary mental injuries, they typically have longer claim durations. They've got higher average statutory claim costs and lower return to work rates. And what that really means outside of the numbers is that they have poorer outcomes for everyone. They have poorer outcomes for the workers who experience them, for their employers, and also for the scheme as a whole. And that's why they are and they will continue to be a key strategic focus for us here at WorkCover. So if we look at primary statutory mental injuries, what we've seen is an increasing trend over the last 6 years. This is in line with what we're seeing in other jurisdictions around Australia, and we expect it to probably continue to grow. And then if we look at the mechanisms, we can see that mechanisms of mental injury, it's increasing across all different mental mechanisms. So exposure to a traumatic event, we've seen a significant increase in exposure to occupational violence, which is the one in the middle there, but really all mechanisms have seen an increasing trend over the last few years. Then if we look at secondary mental injuries, we're also seeing an increase. So claims with secondary mental injuries have actually the highest average days away from work and the highest average statutory costs, and the worst final return to work rate, so even more so than a primary mental injury. And now we're seeing actually around half of our claims that progress to common law injury, to common law claims, have a secondary mental injury or a non-primary mental injury. So a significant growth over the last kind of 10 years that you can see here. So for a quick recap, both secondary and primary mental injuries are increasing. They do have higher days away from work, and they've got higher average statutory costs and lower return to work rates. And what we do know is that early risk assessment intervention can reduce the risk of secondary mental injury, and early intervention can really change the outcomes. Employers play a key role in supporting return to work and recovery, and that's why you're all here today. So thank you for leaning into that role that you play in a worker's experience of their claim and their mental injury. Research from Monash University actually shows that workers who do feel supported by their worker are significantly more likely to experience a positive return to work outcome and a positive experience with their claim. So thank you all for joining us today. Enough from me. Let's listen to someone who has navigated a primary mental injury firsthand. Before we hand over to Deb, I'd like to play this video of Dr. Deb's story. You might experience a short delay as it starts to play, but if our testing has been successful, it will be very short-lived and it will catch up quickly.
It was when COVID had all started, and we were doing a lot of training at Mackay Base Hospital on how to put on your PPE, etc. And I asked my boss if I could go around to the rural hospital so I could teach them. I had just finished my teaching at 3 o'clock in the afternoon, and at 3:15 there was a phone call came in to me saying that there'd been a mine explosion and could I come back because they didn't know how many people were going to be injured. It's a 1-bed ED and we had 5 men come in, 4 of which was severely burnt. And I felt like their lives were all in my hands and I had to make sure that I did everything I could to make sure that they got to Brisbane. And I didn't realise how much it affected me until I did my first presentation on the incident. Within the first sentence, I just couldn't stop crying. One night, my husband got so worried about me, he rang one of my colleagues who came over, and my colleague then rang my GP, and within the next week, I went to Townsville into a private psychiatric clinic, and that was all immediately covered by WorkCover, and that's when WorkCover got involved. WorkCover has now opened up its doors significantly to frontline workers to go and get help as far as post-traumatic stress disorder is concerned.
From the first moment we met, her main goal was getting back to work, but she did work with us to slow that down appropriately. But that positive mindset was definitely one of the things that helped her in her recovery and getting back to work. Between the treatment team, Deb, WorkCover and her employer, we were all able to have a case conference as well, which I think really helped Deb's confidence in everybody was working together to support her, herself included. And we were able to take our time appropriately to do a graded-based approach for her return to work. And she's done really well in that role and is pretty much back to full duties, is my understanding.
The relief I had after I left that clinic was just amazing because I now had a plan of how to get better. I had a fantastic psychologist, a brilliant psychiatrist, and then obviously everyone at work was very supportive, and WorkCover rang me every month to make sure everything was going well. Nothing was too hard for them, and I've been on a back to work program since January 21, and now I'm coming off WorkCover in August and I'm better, which is great. I've also opened up to everybody about this as well. So even our new interns, I try and talk to them early on about mental health and making sure that you seek help if you need it. And I tell them my story right from the beginning to try and demystify and get rid of that stigma. So first of all, I'd say to the people who might see these people struggling is to ask them if they're okay. Try and open up that conversation, because that's the hardest thing. And once you open up that conversation, then people will open up, hopefully, and talk to you. Really just like to put it out there to all frontline workers to please seek help if you need it. And look, WorkCover is there for you, and you know, they really have been a great help, and I can't thank WorkCover enough, because I would not be where I am today if they hadn't been so supportive with everything that I needed.
It's an incredible story, and for those of you who, it looks like we've had a mixed bag in terms of audio. If you couldn't hear the audio, we will share the video link as well. But I would now like to hear first, to hand it over to firsthand, Dr. Deb, over to you.
Thanks, Eve. So first I'd like to thank Eve and WorkCover for inviting me here today so that I can actually share my story with everybody. Before I get started, I just want to tell you a couple of funny things that have happened to me over the last month. This is the fourth time that I've done a similar presentation during WorkWell month. So one of the funny things was in Rockhampton, when I was on the way to the hospital, because I was actually working the same day that I was going to be doing the presentation, the person that picked me up from the airport, he said, I told him I was going to the hospital. He said, oh, my wife used to work in the hospital. She did everything from working in the geriatric unit, working in paediatrics, and then she got to work in the nut house. And then he turned around to me and he said, so what are you here for? I said, oh, I'm just going to be doing a talk on mental health. He didn't really know what to say after that, which I thought was quite funny. And then I was doing a one-off list at the private hospital at the Mater in Mackay. And as I walked in, one of the nurses said to me, are you that doctor that has the mental health issues? Which I thought was really quite a funny way to come across about it, because there'd been a news article about me in the paper to promote the WorkWell Week talks. And I just found that really interesting that somebody would come straight out and say that it wasn't that I'd gotten over it. I actually had mental health problems. And then with the article that came out before I started all of these talks, there was actually a negative comment on social media, just one negative comment from, about 100 really positive comments. And I actually turned around to my husband. I said, I don't think I can do these talks, because I don't think I can deal with the negativity around this. And he actually turned around to me and said, it's just one person. Think about all those other people that you might help. So I thank my husband for being here today. So I want to talk to you about my lived experience. You heard a little bit about what went on in that video, but it really doesn't give you the big picture of how I ended up with a mental health injury and how I overcame that. So there are actually 7 satellite hospitals that are associated with Mackay Base Hospital, all within around about 200 to 300 kilometre mark of Mackay Base Hospital. And there you can see on that picture Moranbah, where the coal mine is, the Grosvenor coal mine. It's a 2-hour drive minimum from Mackay if there's no roadworks, and we all know that's very unlikely. And then our assets for retrievals come from Townsville and also from Brisbane. So you can see how long it takes to actually get retrieval teams in when there's been a major accident. So it was May the 6th, 2020. As you heard, I did ask my boss if I could please go out and teach PPE for COVID to these hospitals. And I had just finished teaching at 3, got a phone call at 3:15 to please go back. And of course, there was no way I wasn't going to go back. I mean, that's, Hippocratic Oath, I'm a doctor, that's what I'm meant to do is help. And I've dealt with lots of traumas in the past. It was really just going to be another day at work as far as I was concerned. So I went into the hospital, I got the nursing staff together, and I did what's called a team huddle, which you do in a crisis situation. And I said to them, look, I don't know what your abilities are. I really don't know what the resources of the hospital are. What I want you to do is get yourselves into groups of 3. We know we've got 5 men coming in. We didn't at that point know how bad they were. We had an understanding that there were 4 that were severely burnt, probably 60 to 80% burns, and 1 that was maybe about 20% burns, but they were all on his back, so he wasn't an airway issue. I asked them, did they have any burn aid, which is a matting that we can put on burns, but really that was a silly question, because with 4 men with 80% burns, no hospital is going to have enough burn aid for that. Then I asked if they had Solugel, which is again another medication that we can rub on the skin. There's no way they would have had enough of that either. And of course they didn't have any. So I just said, can you go to the kitchen and get every bit of Glad wrap that you can, and let's bring it here. We can wrap their burns in that after they're cleaned up. And I said to them, you know, we can definitely do this. I've seen what you can do when it comes to PPE training. I'm sure that we can manage this together. And if you just have a look on that picture, this is their 1-bed ED that they had, and they also had a 2nd bed, but that was in a consult room, so with their 2-bed ED. Really, the space was only just 4 times bigger than what you can see here that we had to try and fit 4 men into. And if you just take note of the video screen up the back, and also the camera that you can see over in the corner there as well, I'll talk about that a little bit later. So while I was doing this quick briefing with the team, I also got a phone call from Rural Exec. Rural Exec understood that I was doing my road trip, but they didn't know where I was in my road trip. And Rural Exec rang me and said, Deb, we're just wondering where you are right now. I said, it's okay, I'm in Moranbah. And they said, oh, thank goodness for that. So now I felt like I had this pressure from Rural Exec as well. They didn't put that pressure on me, I put it on myself, that we really had to try and make sure that these boys got to Brisbane safely. The ambulance officers decided to grab and run, as we call it, instead of stay and play. So they just loaded these boys into the ambulances. Also, the mine nurses brought a couple of the men back as well. So there was 3 vehicles that brought 5 men back. And they all arrived at the same time. And they had triaged these boys, which meant that that was one thing that was taken out of my hands. So the first young man rolled in on the trolley, and he was very unwell. I thought that he was going to pass away in front of me. He was shaking like a leaf. He was drifting in and out of consciousness, and he was very, very severely burnt, including facial and torso burns. And with facial and torso burns, we have to automatically assume that there's going to be airway burns. As soon as you have airway burns, you must get a tube down into the lungs as quickly as possible, because if you don't, those airways close over and we have lost that person. So I knew that I had a very short period of time to get to all 4 of the seriously ill boys to intubate them. So as I was getting ready with the first young man, the second one came rolling through the door, and he looked exactly the same as the first one, covered in soot, burnt face, burnt torso, burnt abdomen, burnt arms. There was no way that we were going to get intravenous cannulas into these men, but there was a really excellent GP there who was fantastic and put what we call interosseous needles. So that's going through the bone into the bone marrow, so that we could give these men medications and fluids to make them comfortable, get them off to sleep and get them fluid loaded. So then the third man rolled in, and he looked exactly the same as the first 2. And it was at that point that I turned around to myself and I said, I'm not going to be able to save all these men. So I didn't put the pressure on the team. I put the pressure on me, that it was up to me to make sure that these 5 men all got saved and got sent to Brisbane. What I didn't realise until afterwards was that the burn surgeon who had heard about this incident had already said to her team, look, we're going to be lucky to get 2, maybe 3 of these boys back alive. She was very, very surprised that they ended up getting 5 back. In that time period as well, the team were absolutely fantastic. All the boys got intubated in time. They had their fluids running. We had them on sedation medications. None of this could have been done without that team. They were absolutely exceptional. And I was really concerned that these boys' arms were swelling to the point where they were cutting off the circulation to the hands, and therefore they might lose limbs. So I asked I rang up comms, and I said to comms, hi, my name's Deb Simmons. I'm just going to give you an update of what's been going on. And all the boys were intubated at this stage. And they said, that's okay, Deb, we've been watching you the whole time. So they had been up on the monitor, up on the the cameras, watching everything that the whole team had been doing. And they didn't interrupt because everything was running so smoothly. And we actually got the comment in a debrief afterwards that they couldn't believe how calm and quiet the scene was. And that, again, is up to that staff there. We didn't have to do cuts in the arms to release the pressure. The burn surgeon went in. We took our telehealth monitor around so she could view each one of these boys at the bed end and see what was going on with them. And then the first retrieval team arrived at around about 6:30. So this is, 2.5 hours after the first boy arrived. And they had an ultrasound, so we could actually ultrasound their arteries to make sure they still had perfusion, and they were all fine, because I was actually Googling how to do an escherotomy because I thought I was going to have to do that while I was there, but thankfully that didn't happen. So in the next slide, this is the team. This is the absolutely wonderful, amazing team. And the next day, exec asked me if I would stay back the next day because the mine minister was coming, and they wanted me to talk to the mine minister. And I did a very small TV news interview. And what the mine minister said was that I was a hero. And I wasn't really very happy with that comment. And I was very lucky that a reporter asked if she could do an interview with me on tape. And she asked me the question that I was held a hero by the mine minister, and how did I feel about that? And this is what I said to her. I think the real heroes are the nursing staff that stepped up to a job that nobody should be confronted with, and did marvellously. It was this small rural hospital that had a 2-bed emergency department that managed 4 patients that needed to be intubated and ventilated for 3 hours, and had them ready for the retrieval teams to pick up. They're the people that saved those men's lives, and I believe that every single day since then. And I have to tell you, in a small hospital, there was only 1 ventilator, which meant the nursing staff, the ambulance officers, and the 2 in high vis were the nursing staff from the mine. They had to rotate and hand ventilate these men for 3 hours while we were waiting for the retrieval teams to arrive. So you can see that the lives were actually in their hands, not just mine. So then we did a hot debrief the next day, and Mackay had organised for an employer psychologist to come to Moranbah, where we all were, and she did a bit of a, I know what's going on, I'm just here to see how you're all faring. Like in any situation, nobody was willing to say the first word, so I decided to speak up. And the words that came out of my mouth, I didn't even know that they were going to come out, were I didn't think that we were going to be able to save all these men, and I just completely lost the plot. The nursing staff were beautiful. They crowded around me. They gave me hugs. And then we managed to get on with the conversation where everybody talked about how they felt. We got offered immediately, some follow-up employment psychology sessions. And then the next day I left the hospital. So as a doctor, when there's a major trauma, a major emergency, when the team works together, we spend, weeks, months talking about this. We all do our own sort of debriefing within that group. Now, because I had to leave Moranbah, I never got that chance to do that with that team. And I think that might have been one of the things that led to me becoming unwell with a mental health injury. I did a cold debrief about a week later, and that was with all the teams. It was with Moranbah, the ambulance service, the mine nursing staff, the retrieval teams, and also the burns hospital. We all had to prepare something to talk about in this talk, and I prepared what happened at Moranbah. And again, I found it very, very difficult to try and get through. And I'd speak a couple of sentences and burst into tears. And luckily, the person that was convening it was able to jump in and talk about a few things before I could pull myself together and start talking again. I did get asked a question in that presentation as to how did I manage to run around and intubate 4 men and run the show? Did I just go into robot mode? And I found that a little bit disappointing, because as an anaesthetist, whenever I put somebody off to sleep when they're having an operation, I know the thing that they fear the most is losing control of their body and me taking that over. So I always bend down to every single patient and I say, I'm going to drift you off now. I've got you. I won't leave you for a moment. They are the last words the patients hear from me until they wake up again. And I knew with the boys, I couldn't say that because I wouldn't be there with them the whole time, but I knew that the pain was going to be the thing that is worrying them the most. So every single one of them, as the anaesthetic medication went in to put them off to sleep, I knelt down and whispered in each one of their ears, I'm going to take your pain away now. I've got you. Because I felt that they might be the last words they ever heard. And then about 2 weeks later, I got asked to do a department presentation. I thought to myself, yeah, I can do this. It's been a couple of weeks now. And again, I still could not get more than a couple of sentences out. My boss at the time was there at the presentation. He pulled me aside. It was a Friday. And he said to me, look, I'm going to take you off shift today. I'm going to take you off call on the weekend. Let's go out and have some lunch. So he took me out for some lunch, and I told him all about, what was going on. And he said to me, you're going to be okay for work on Monday. I can certainly get somebody to cover you. And I said, no, I'll be fine. I figured it's just memories. It was a big thing that happened. I haven't really had time to debrief. I found it hard to talk to colleagues about it because I felt, sort of like maybe I was showing off by talking about it. So I sort of kept it to myself and didn't talk about it like I normally would. I just kept on saying to myself, it's just memories. And then I would be walking along the corridors, and this happened in May, and around about the July, August, I had gone back to Proserpine Hospital to work. And I'd be walking along the corridor, and I would have these visions of that first young man who I'm looking down at that I think is going to die in front of me. And I just have to stop and blink my eyes and try and push those memories back, because I was at work and I had to keep on working. And then it got to the point where my husband would wake me up at night and say, Deb, you've been screaming, you've been having nightmares. And I didn't really remember much in the way of nightmares at that point. So I went and discussed it with my GP, and she first of all said, maybe you might have some post-traumatic stress disorder. And I said, no, that's not possible. I don't have a mental health problem. I don't want to have that stigma of mental health. I'm fine. I've dealt with lots of traumas in the past. I've never been affected. This shouldn't be any different. So she said, okay, then, no worries. Let's just give you an anti-anxiety medication. Maybe that'll help you sleep, and maybe that'll help stop the nightmares. So that's what she did. And then I noticed that because I was waking up now with my nightmares, and I was remembering my nightmares, that I was having nights in a row where I wasn't sleeping. So I would take days off work because patient safety is always the utmost concern. And I didn't feel I was safe looking after patients if I hadn't had sleep. And I have one reoccurring nightmare that I still remember to this day, but it doesn't affect me like it did back then. And that nightmare, and I'm sorry, it's a bit graphic, was me standing in a field with 5 men, a light around me, all saying to me, please help me, please help me. And I would just wake up screaming. I kept on telling myself that I was okay, that this was just thoughts, just my brain trying to sort this out. And what I haven't said yet is that I gave the burn surgeon my phone number. I used to ring up every week and then every 2 weeks to find out how the Burns boys were going. And I did this for months after the incident, just to see how they were getting on and make sure they were okay. And, I said to her at one stage, I would really love to have a chat to them. And she said, look, give me your number, and when they're ready, they can call you. And I thought, that's fantastic. And now it's January the next year, and they hadn't contacted me. So I started thinking to myself, I've got to put these men through years of pain and agony and surgery, and maybe they're really unhappy that I saved their lives with the team. Maybe I shouldn't have saved their lives. Maybe that's why they're not calling me. And I think that was the tipping point for me. So with that, I phoned my best friend, who's actually CNC of the emergency department of Proserpine. I said to her, I shouldn't have saved these men's lives. So that is abnormal thinking, abnormal words coming out of a doctor's mouth. So she said, yeah, no worries. And she hung the phone up on me. And I'm thinking, now my best friend doesn't even want to hear me talk about it. But what I didn't know was that she was calling one of my colleagues, and 20 minutes later, they were both at my house. Had my very first Valium ever. We'll never take it again. It's a horrible drug. But anyway, it was needed at the time. And the next day, my GP rang me. She said to me, Deb, this isn't like your normal traumas. This isn't just another day at work. I think that you've got post-traumatic stress disorder. You need to see a psychiatrist. She told me the only way that I could do that, this is in the time of COVID, she said, was to be admitted to a psychiatric clinic in Townsville, and the psychiatrist would see me 2 days later. I said, I'm not going to a psychiatric clinic. As soon as I do that, it's going to go on my record. What's going to happen to my job? What's going to happen to my career? I'll be reported to AHPRA for having a mental health illness. And she said, Debbie, if you don't go, I'm going to report you to AHPRA because you're not looking after yourself. So I really realised at that point I had no time. I was still really angry about it. So I went to the clinic. My husband drove me up there, and I was put on suicide watch. I wasn't suicidal, but I was put on suicide watch because that's what they do for the first 72 hours. As I walked in, they took away the razors so I couldn't shave my legs. They took away my shoelaces so I couldn't hang myself. And it was really, really very confronting. I had somebody come into my room every hour to see what I was doing, make sure I was okay, even at night time. I refused to go downstairs to eat. I made them bring the meals up to me because I didn't want to associate with anybody else that might be in a psychiatric clinic. And then I saw the psychiatrist on day 2 in the evening. I spoke to her for an hour and a half. That's when she told me I had severe post-traumatic stress disorder and I'd have to be in that clinic for at least a month. So I had to make some decisions at that point. And the next morning, I got a phone call from WorkCover around about 9 o'clock in the morning saying, Deb, my name's Kimberly. I'll be your case manager. I don't want you to worry about anything. I'm going to talk to all of the people that are involved. We are going to get this sorted for you. All I want you to do is concentrate on getting better. So from that point onwards, I felt like I had somebody who was backing me, who was behind me, who I knew would follow me through. Well, I felt so they would. I was very lucky. I had one case manager all the way through and her name was Kimberly. I've never met her. I spoke to her on the phone a lot. She had a huge amount of empathy for me. She was exceptionally supportive. She let me know what was happening every step of the way. She informed me every step of the way what was going to happen all the way through from being in the clinic to my return to work to finally coming off WorkCover. She made me feel as though she had no other clients except for me, that I was the only one that she was looking after, even though I only spoke to her once every 2 weeks or once every 4 weeks. And I think that that was one thing that really helped me through. And I know that it's not always possible to have one case manager and that it's very distressing for them as well and they need time off too. But I was exceptionally lucky for that to actually happen to me. So I decided that I was going to throw myself into this. I realised my psychiatrist now told me I had post-traumatic stress disorder. My GP was going to report me to AHPRA if I didn't get help, so I had to do this. So I decided to really throw myself into absolutely everything. So this is the Strand in Townsville. That's my parrot, Rosie. You can see she's on a harness, so she's not going to fly away. I was very lucky. My husband drove up with the caravan. He stayed up there for the month. I was on a curfew. I had to be back in the clinic at 8 p.m. and wasn't allowed to leave till 6 a.m. So 6 a.m. every morning I was at that door waiting to go for my walk with my husband and my parrot along the Strand. I fell in love with long ice blacks up there because I love my coffee, but it was too hot to go for a walk and drink a hot coffee. I threw myself into art therapy, there's painting that I did, walking therapy, yoga therapy, mindfulness classes. I did eye movement desensitization and reprocessing with my psychologist who you saw in the video, and dialectical behaviour therapy. And I really threw myself into everything. And at the end of my time there, at the end of my dialectical behaviour therapy group, I made up these show bags for everybody, which had a stress ball, strong mints, which is something that you can use to try and bring yourself down if you're feeling really anxious, and origami paper so you can do something that's mindful. And I gave that to everyone that was in my group just to say thank you for all helping me. So I spent a month in the psychiatric clinic and I worked the hardest that I could to actually get better. But now I had to get back to work. Workers' compensation stakeholders in Australia and elsewhere have said that the workplace is the single greatest influence on return to work outcomes, and I can absolutely tell you that that is the fact. My supervisor at work rang me when he knew I was going into the clinic and said, don't worry, your job will be here for you when you get back. We really think that you're worthy and we want to make sure that you get better. We want you back the way that you were. To me, that was really beautiful. They sent me a bunch of flowers. It was really, really lovely. I knew I had support from my work. So what we did and the last day in my clinic was Kimberly and all of the stakeholders, my GP, my work, HR from Mackay Base, my psychologist, my psychiatrist, my GP. We all had a case conference together and we made a discussion. It was a discussion about what my return to work plan was going to be. And I had a big say in that as well. So I felt as though I was part of that. And because I felt as though I was part of that, I was really motivated to make sure that what happened really moved ahead as quickly as possible. And as you could see in the video there, my psychologist had to keep on reining me back to make sure that I went at a pace that was going to get me back to work in time, but not put me in harm's way to possibly cause a secondary injury that I might be set backwards, because I still had to work in a hospital where there was trauma coming in. So as I'm not only an anaesthetist, I'm also a rural generalist. I could start off by doing just clinics where I just did face-to-face with patients where there wasn't any trauma. And then I got to work on the wards where we don't keep trauma in Proserpine. They all get sent down to Mackay, so I wasn't confronted with any trauma. And then I got to work in theatre as an anaesthetist again, but we don't do any trauma work in theatre in Proserpine, so that was safe as well. And finally, I got to go back and work in the emergency department. I had really excellent communication with my supervisor all the way through. At least once a week, he would ask me how I'm going. Is there anything that they could do better? Anything else that I needed? I was absolutely supported. It was two steps backwards, one step forward. So there were a number of mine incidents that happened during my return to work, and every time I saw that on the news, it would set me backwards. I'd need an emergency appointment with my psychologist and psychiatrist and my GP, and that would set me back a few days because I'd have to go to Townsville to do that. So there were days where I wouldn't turn up at work. I was still having nightmares. I would still have to ring in if I'd had a couple of nights in a row where I hadn't slept. And of course, unfortunately, what happened was my supervisor, we are drummed into us in medical school about confidentiality. So we're not allowed to talk in lifts about patients, we're not allowed to talk in coffee shops about patients in case there's somebody around that might hear it. So my supervisor hadn't passed on to my colleagues that it might be 2 steps forwards, 1 step back. I was just on a return to work program. And through the grapevine, I heard that there were people talking behind my back about why is she bothering to come back to work if she's not fit for work. Every time she calls in sick, we've got to try and cover her. We've got to try and find someone. It's not fair on us. And I can completely understand where they came from with that. So I thought to myself, what am I going to do about it? I didn't really want to talk to my supervisor because I didn't want to get any of my colleagues into trouble. So I thought, I'm going to have to take the bull by the horns and do this myself. I grabbed one of them on an opportunity and we went and had a cup of coffee together. And I came straight out and said, I know you've been talking behind my back. No, Deb, we wouldn't do that. We haven't. So I told them the exact wording of what had been said. And they really couldn't come back from that. And they said, well, it's the truth. Why are you bothering to come back to work? So then I explained about the 2 steps forward, 2 steps forward, 1 step back. And they were absolutely wonderful. They listened and they heard. And I didn't have to speak to anybody else that was talking behind my back. That one person made sure that they went and spoke to all of my other colleagues. And I had huge support after that, huge amount of support. And in fact, I even had people coming to me and say, don't ring work to say you're sick, ring me and I'll come and cover you if you had nightmares. But it was to the point where I felt that maybe I couldn't get back to work. Maybe I didn't feel safe in my workplace. I felt that maybe I wasn't worth what my supervisor was telling me because my colleagues had to feel that worth as well. And I'm glad I had that talk with them because then I found out that I did have that worth. The other thing that was happening at that point in time was this was now a year and a half on from the original incident and my husband was getting care fatigue. So I was also having a few difficulties at home. So things were really starting to bank up on me. But once I got that support from my work, and I told my husband about it, he became more supportive. And it seemed to be that one thing that was stopping me now was really pushing me forward, that I had all this support from everybody to get back to work. So just remember, we don't know what's going on in people's private lives when we've got somebody who's got a health injury, no matter what it is, at work. So with my return to work as well, the healthcare experience is really important. My case manager made sure that everybody was on the same page. I had my general practitioner who I could go to with my issues. They would contact the case manager. If I needed an emergency psychiatric or psychological appointment, that was going to happen. The workplace knew everything that was happening because of my case manager that ran everything. And I was also empowered to make decisions on getting back to work, which I think to me was probably one of the most important things to me. I had a return to work goal. I had dates set onto when I was going to move from clinics to the ward to anaesthetics to ED and then finally back to on-call again. So I had these goals that I could actually work towards. So all stakeholders were aware of where I was in my recovery and there was no setbacks because one person thought it was this and one person thought it was that. So there was going to be confusion. So I'm very lucky with that. There's also what's known as the locus of control. So the locus of control is whether somebody has an internal or an external locus of control. So an external locus of control means that you believe that things get better in your life or happen in your life or get worse in your life because of the people around you. Whereas having an internal locus of control means that you believe that you get better or things get worse or things go wrong around you because of things that you do yourself. And I've got a very strong internal locus of control, and I felt that I could take this on and I could make sure that things got better. If I had a very strong external locus of control, I think that my colleagues talking behind my back might have actually destroyed me and not helped me get back to work. So we can see that people that have a strong external locus of control, the more support they get on the outside, the more likely they are to get better and return to work. So what I've been basing my talk today on is my own lived experience, but also on a paper that has the lead author of Dr. Mary Wire, who is going to be doing the webinar next week. And that paper is A Pays to Care. And at the end of that paper is a call to action. The paper was put out in 2022. And I see that paper as an evidence-based empathy report and how that we can use empathy to try and help people get back to work, whether it's a mental health injury or whether it's a physical injury. And the call to action is that we need to look at honesty from both sides. So every one of these things I'm going to talk about has got to be the workplace and the worker and everyone else is involved. So I'm really glad that my GP was honest with me and told me that I was going to be reported if I didn't go and get some help, that my psychiatrist told me you're going to have to stay here for a month, that I got pushed from those external people to help me internally help myself, but also my work saying, look, honestly, we really want you to get back. We understand there's going to be some hiccups along the way, but we want you back. But we do need you to work at it as well, Deb. You can't just expect us to just keep on laying back and waiting for you to come back. You've got to push too. There was respect from everybody that was involved in my care. Respect from my workplace, respect from all of the healthcare professionals, and a huge amount of respect from WorkCover. There was absolute fairness, but the fairness had to come from me as well, not just my work and the people that were helping me. I had to be fair in my want to get back to work and the work that I put into that as well. I had a huge amount of compassion once I'd come over that little bit of a hurdle with my colleagues, huge amount of compassion from everybody, and that made me work harder to try and get back to work. And that compassion came from my work, which made me want to work harder to get back to work because I actually had some work. And there was that collaboration that I didn't have to worry about. That was all looked after by my case manager, by WorkCover, by my colleagues, by all of my healthcare professionals, and by my GP, who was really my rock through all of this. So we need a call to action that we actually have this honesty, respect, fairness, compassion, and collaboration from both sides, the workplace and the worker. So that we can actually help people get back to work. We need to increase that 73% of people that get back to work after a mental health injury, up to the same 93% work. There's always going to be a couple of people that have a problem. We need to look at this vulnerability conversation, open up that conversation. If you think somebody's struggling, please just ask them, are they okay? But not only that, the workers themselves, if you're not okay, you need to go and talk to someone and ask somebody for help. Say you're not okay if somebody asks you that question. I wish I had done that a lot earlier. What I'd like to do now is show you a photograph. These are the 4 boys who were most severely burnt: Dale, Peter, Clayton and Wayne. Clayton is a young man in the front who I thought was going to pass away in front of me. They all have family, they all have children. The reason why they never rang me was because the burn surgeon forgot to give them my number, and that was the only reason. I'm really good friends with all of them. In fact, next weekend I'm meeting Dale and his family, and we're going to be celebrating my birthday together in Rockhampton. Dale, who's the one on the left-hand side at the top, a few funny things with him. His mates, who are the boys there, call him 18 months or year and a half because he's only got a half an ear, so year and a half. It's quite funny. During COVID, when he'd have to go into Rockhampton Hospital to have things done, or go back to the Burns Hospital in Brisbane to have things done, they'd ask him to put a looped mask on, and he'd say, hey, come on, guys, where am I supposed to put it? How am I supposed to put this on? And his brother's children call him Pop, And after all of this, he asked them to please call him Crispy Pop, so they call him Crispy Pop now. So where am I now? I'm giving these talks. I'm happy to give these talks to anyone who's willing to listen, to try and put forth the idea that we need to destigmatise mental health. We need to talk about it. We need to destigmatise going on an insurance claim for any work injury, so that people can get early help, and we can actually get people back to work quicker. And we need to make sure that we support and we make sure that people are worthy and they feel worthy going back to work. So I still do work casually through Mackay Base Hospital, and I do some private work in Rockhampton now. And I have to say, in August last year, I was confronted with a 60% burns patient at Proserpine in the emergency department. I didn't know how I was going to handle it, but one of my colleagues stood by the pillow of the bed with me and kept her hand on that pillow so that I could see it while I was intubating this man. He was intubated, he got sent down to Brisbane, he was fine. I left the hospital, I got through it without a problem. I pulled over onto the side of the road on my way home and I just burst into tears, not because I was upset, not because I was traumatised, but because I was happy that I was well. And I knew that I was well because I could do that case, and I never had any after effects after that. So I'd like to thank everybody today for being here and listening to my story. Thank you.
Oh, Deb, thank you. I think I can look at this, look at the reactions coming in. Not only your incredible bravery and strength to navigate your own experience, but your passion and your courage to share that with people, I think is just, it's takes my breath away. Thank you. Thank you for being here with us today.
Thank you.
We have time for a few questions with Dr. Deb, and I'm actually going to go off script and start with one that isn't on the screen here, and ask you how your workplace experience changed the way you manage WorkCover workers who you see in your practice.
I'm really sorry to say that I needed something to happen to me for me to change the way that I do things. So for working in the emergency department, we see workers that come in with their injury firsthand. And the usual way that we do things is fill out their WorkCover form, make them off work for a week until they can see their GP, because we can't follow patients through in the ED on WorkCover claims. They can only be followed through by someone who's going to continue to follow them through. And then we send them out the door. What I do now is I realise that seeing a GP doesn't happen in a week. It can take 2 weeks, it can take 3 weeks. So I will ask the worker what they need from me in that time period before they see their GP. Do they want that time off work? Do they want to get back to work at lighter duties if at all possible? And not only will I do that, I'll also ring the GP practice and I will make that appointment for them, so I know what length of time they're going to be before they actually see their GP. So actually the ball starts rolling, and I talk to them about, you know, if your workplace doesn't contact you, please contact them and let them know what's going on. Don't hesitate to talk to WorkCover, with WorkCover, and make sure you do follow things through with your GP, and just realise that it's okay to go on WorkCover. It's not a stigma. It's really important that you get yourself better and you get back to work, not only for yourself, but the things that occur outside of work, such as your family and your friends as well.
And one of the other ones we've had come through is around EAP, and I think you kind of touched on this in your early experience in not maybe thinking you needed EAP at that point. Am I right there?
Yeah. So I certainly had it offered to me on a couple of occasions. So when it first happened, and also just after I gave the presentation to my team of anaesthetists, but I didn't recognise I was unwell. I just thought that it was memories and that I would get over it, and how could I be unwell after dealing with hundreds of traumas in the past? Why would this one particularly affect me? I think that if you do have that available, it's really important, if you feel as though you're unwell, to please get onto your workplace psychological services as soon as you can, because the sooner you can do that, the sooner somebody can diagnose and the sooner you can get some help.
Absolutely. And then we had a bit of a chat about question 2 or 3, which kind of we have interpreted in somewhat similar ways, which is how do you know if you're being pushy or if your worker wants support and wants that feedback? And Dr. Deb and I were kind of chatting before this webinar around really one of the best ways is to ask your worker what kind of support, what good support looks like for them. And for some people that might be every day, it might be every week, it might be every month, it might be via text message, it might be an email, it might be a call, it might be a coffee. We are all human and we all respond to different things differently. So the best way to kind of get around that is to ask the question of the person who's going through that experience.
Yeah, I would say that absolutely. So I think definitely ask that person what they need, because we are all different. Some people just don't want to be bothered at all. Some people need a daily recognition that they're being supported. So I think asking that person, asking too much and being described as discrimination, I can see where that can come across in that maybe you're being, really looking after the worker to the point where the workplace feels like they might be discriminated against. Again, I think maybe even getting a meeting between the workplace and the worker with mediation, if necessary, to try and iron that out as to what both parties need. But to keep everybody in the loop and on the same page, I think is the most important thing.
Definitely. And you don't have to do it alone is the next piece of this puzzle. So we have been working, thank you, on some new resources, and we'll share all of these with you following today's webinar. But these are really, they're tools for our employer customers to help you navigate mental injuries. And we have 3 series that have come out, and we'll have a few more coming out in the following months. And then we're also working on some new resources for workers as well. But mental injury essentials really is for employers who are new at mental injury claims and want to improve how you're supporting your workers. Understanding mental injury claims focuses on primary mental injuries and can talk about things like suitable duties for or return to work for mental injuries, as well as accessing provisional psychological support. And then the third section is around supporting the mental health of a worker with a physical injury. So those resources can be found on our website, and we've also got a bunch of other valuable resources. We'll send this link out, so don't worry about writing it all down, but you'll be able to link through to these great resources that are available. You've also, if you have a relationship manager here at WorkCover or your case manager for a claim or need general support, you can contact WorkCover as well. And as mentioned earlier, this is part of a 2-part series of webinars around the important role that an employer plays in a workplace mental injury. And as Dr. Deb mentioned, next week we will be joined by Dr. Mary Wyatt, who is the lead author on It Pays to Care. And she's going to talk about, from a best practice perspective, the employer response. So I hope that you can join us for that as well. If you haven't already registered, we'll send out the link in our follow-up email. But I would just like to take another moment to acknowledge you, Dr. Deb, and your wonderful and powerful story. And thank you so much for joining us here today. And thank you to everyone online for leaning into your important role as an employer. We appreciate you.
Thank you. Thank you.